Good morning, everyone. Very nice to see you here again. Today we will have a very interesting section. My name is Daniele Magalhães. I'm the Senior Project Director at the Global Consortium on Climate and Health Education. And we are very pleased to have all of you here. And we know that some of you is passing through a very difficult situation in your region. And we are very sorry for that, and our hearts are with you. And today we will also discuss a topic that is connected with conflict and also with climate change, and all these things exacerbate the water security. So today we are going to talk about water security. We have simultaneous interpretation in Arabic. We also have closed caption in English and in French. So for the simultaneous interpretation, you can use the globe icon, and for the closed caption, you can use the CC button or the link in the chat. The course objectives is to enhance the knowledge, confidence, and communication skills of both currently and future health professionals concerning the climate change impact on health, so they can deliver improved public health and clinical care by recognizing and addressing climate risks, and serve as a trusted advocates, influencing policy and practice within their institutions, communities, and professional networks. This course also have the objective to equip current health professionals with the knowledge and skills to educate their institutions' own learners, ensuring that climate-related health impacts and emergency preparedness are systematically integrated into pre- and post-licensure training worldwide, and also to build and strengthen an agile and informed community around climate and health education, advocacy, and policy for health professionals with strong mentorship and expert support. So today we are in session 5. I really would like to have your attention on our agenda. So the next week there will be no class because of the regional holiday, the Ramadan holiday. So no class next week. So we will come back on March 25th for the session 6 on floods, waterborne diseases, and other health impacts. So it's a little bit connected with the session that we are going to have today. But today we are going to talk about specifically on water security, which is a major issue in the region, and climate change is also contributing even more to make this impact worse. The session learning objectives is to describe how climate change affects freshwater availability, quality, quantity, and distribution in the Eastern Mediterranean, examine and elaborate the health impacts associated with water scarcity and water-related hazards, explore strategy to enhance water security, including conservation techniques, efficiency irrigation methods, and community-based adaptation. To explain the interaction between water security, agriculture, and food production under climate change. And learn objectives on the links between water security and WASH infrastructure. So the session will have 90 minutes. We'll have a lecture presentation, and then we'll have a case study presentation. And at the end, we'll have our discussion time. So I will ask you, if you have questions for the speakers, please include them in the Q&A box that you are going to find in your Zoom bar. The session will be recorded, and the video will be available for you within 48 hours after the session. The attendance recording, we have different types of attendance. We start with a very restrict attendance policy, but due to the last episodes in the region, so we try to make sure that everybody have the opportunity to take the courses. So you can choose one of the options or a combination of options to attend the course. You can be in the live Zoom and we are going to record your attendance. You can watch the recording in the YouTube, or you can watch, if you don't have access to YouTube or Zoom, you can watch the recording that we are going to include in our Google Drive. And every week we send you emails with all these links, and we also will include some links here in the chat as well during the course. And how will attendance be counted? You'll be asked to sign a statement at the end of the course confirming that you watched at least 7 out of the 11 sessions. And by doing this, and also having a final exam score higher than 70%, you will be granted a certificate. The final exam will be happening at the very end of the course. After the last session, we will open the exam, and you have 1 week to complete the final exam, and you need to complete in one sit, and it's about 25 multiple choice or true or false questions. If you haven't joined yet our WhatsApp group, please do it, because I think this is the easiest way to communicate and faster way to communicate. I'm the one, me and Maggie, we are the ones who control the WhatsApp group, so you can send message for us if you have any problem and any issues, and we will be happy to respond to you. So today we have 2 amazing presenters and women after the Women Days, and so we have these amazing professionals here to share with us their experience. We have Dr. Rola Al-Emam and Dr. Maysoon Al-Zoubi, and we will start with Dr. Rola Al-Emam. I will stop sharing. So Dr. Rola is currently working as the WASH Technical Officer at the WHO EMRO, supporting 22 countries in the region. Dr. Al-Emam has over 15 years of experience in WASH, climate change, occupational health, and healthcare waste management. She has contributed to several WHO documents in her areas of work, including the WHO, IAA, Water Safety Manual, step-by-step risk management for drinking water suppliers. She holds a MPH from Johns Hopkins Bloomberg School of Public Health in the US, and a Master in Science in Pharmaceutical Healthcare from the Long Island University, and a Bachelor in Pharmaceutical in Pharmacy from the University of Jordan. So I will share your presentation. Mm-hmm.
Thank you, Dr. Daniele. Okay, great. Thank you very much. I'll try to be as concise as possible and not go over the time allotted for this session. Okay, great. So today I'll be talking about water security and climate change in the Eastern Mediterranean region. Next slide, please. I will be presenting the following topics. Dr. Daniele presented the learning objectives, and so these very much tie and are aligned to the objectives of this session. So I'll be presenting first on climate change and freshwater availability, quality, quantity, and distribution in the Eastern Mediterranean region, the health impacts associated with water scarcity and water-related hazards, what strategies are there to enhance water security, the interaction between water security, agriculture, and food production under climate change, and the links between water security and water infrastructure, with specific focus on water infrastructure in healthcare facilities because of the nature of this course and the target audience. Next slide, please. So there were many reports that were published on that address water scarcity and water stress. For example, the FAO UN Water 2024 report stated that approximately 10% of the global population lives in countries with high or critical water stress. But a very recent report that was published this year from the United Nations University on the title was Global Water Bankruptcy. So this report states that the world has moved beyond a water crisis and into a state of global water bankruptcy. Nearly 3/4 of the world's population lives in countries classified as water insecure or critically water insecure, and around 4 billion people experience severe water scarcity for at least 1 month each year, while drought impacts cost an estimated of 307 billion annually. So next slide, please. But let me say something, and also there's in a 2021 report, over 2 billion people live in water-stressed countries, which is expected to be exacerbated in some regions as a result of climate change and population growth. And this is from a UN Water report. Next slide, please. So, yeah, so life on Earth depends critically on the availability of water. Climate change is a risk multiplier for water sanitation and hygiene. I'm sure you're already aware now and familiar with the Intergovernmental Panel on Climate Change, the IPCC. So the sixth assessment report concludes that the global water cycle is intensifying, increasing variability and the severity of both wet and dry events, so droughts and floods, and elevating health risks from floods, droughts, and heat. The recent reports from the IPCC and the Mediterranean experts on environmental change indicate that the Mediterranean region is warming up to approximately 20% faster than the global average. The region is already recognized as one of the most water scarce globally, with several countries experiencing severe levels of water stress. And projections further indicate that highly populated countries in the region are likely to face the largest deficits in the water availability under moderate climate change even scenarios. So the accelerated warming is disrupting rainfall patterns and contributing to rising sea levels, placing additional strain on already fragile socioeconomic systems. These findings all confirm that the Mediterranean is a major climate change hotspot, where increasing climate hazards are intensified by high levels of vulnerability and exposure. Among the various risks, drought stands out as the most significant and widespread threat, driven by increased evaporative demand and reduced rainfall. The climate change has a major impact on these conditions, especially when it comes to the melting, of course, also of the polar ice, which converts fresh water into seawater and affects the overall availability of fresh water supply. Climate change also affects water quality, and we'll talk about this now in a second, by promoting the growth of pollutants through erosion, turbidity, and flooding. Severe droughts and massive flooding are being caused worldwide by the intensification of the water cycle as a result of climate change. So a general decrease in precipitation in many of the Eastern Mediterranean countries is foreseen, resulting in enhanced droughts and a growing number of dry spells. Next slide, please. So, and there are also specific impacts of climate change on water availability and water security in the Eastern Mediterranean region, such as the lengthening of the dry season for most of the EMR countries, a projection of 30 to 70% reduction in recharge of aquifers in the Mediterranean coast, impacting the quantity and quality of groundwater. So significant reductions in surface and subsurface water availability. These directly affect river flow, in-stream flow, and the soil water reservoirs. The later, the soil water reservoirs, will have adverse consequences, of course, on food production and food security, adding to the pressure on the groundwater aquifers and surface water reservoirs in the Eastern Mediterranean region. Dr. Maysoon Al-Zoubi will later talk about the case, also a case study from Jordan, but also there's another projection that in Jordan, available water resources are expected to fall below the 50 cubic meters per capita per year threshold, which has been identified as the minimum amount required for social and economic development. So in Jordan is suffering from severe water scarcity. So simply, decreases in precipitation will reduce available drinking water for city inhabitants and green spaces. Next slide, please. So how does climate change affect water? When we talk about water availability, the growing frequency and severity of floods and droughts across many regions, both floods and droughts, as we mentioned, there will be a projected reduction in water reserves stored in glaciers and seasonal snowpack. And there will be, very importantly, intensifying competition for water resources between wash needs and agricultural use in countries and across transboundary, across countries. On water quality, the rising water temperatures are expected to worsen water quality and pollution levels. There is already a wash crisis in the region, and climate change is not creating it, but it's making it worse. The world's freshwater resources are increasingly polluted with organic waste, pathogens, fertilizers, pesticides, heavy metals, and other emerging pollutants. There are disasters such as floodings, which are associated with the contamination of drinking water resources. Rising temperatures contribute to that issue because warmer waters are often better suited for pathogen development. And pathogen contamination is the most widespread water quality problem in developing countries due to unsafe water and sanitation. And we will see what the status of wash or water in the region, let's say. For water infrastructure and management. Oh, and I forgot to say that sea level rise is also driving saltwater intrusion into the coastal aquifers. For water infrastructure and management, the climate change places increasing pressure on existing water infrastructure and challenges the current water management systems. So climate change threats to wash are substantial. With increased flooding will damage the infrastructure, degrade catchments, and contaminate water supplies. Floods will lead to overflowing of pit latrines where they are available, or tanks or sewers, and bypass wastewater treatment to works, as well as bring polluted runoff from the agricultural land, cities, and industries. Droughts will reduce water availability and degrade the source water quality. So as a result of climate change, water is expected to decrease in availability and quality. Next slide, please. Okay, and this is from the WHO and UNICEF joint monitoring program, which monitors and reports globally on the status of drinking water or wash in general in households, in schools, and healthcare facilities. So for drinking water in household service levels from the Eastern Mediterranean region, 64% of the population have access to safely managed drinking water. So we're left with 36% with no access to safe drinking water in households. But what does that translate to? To more than 295 million people in the region with no access to safely managed drinking water. And I think you agree with me that this is a very large number. Next slide, please. And this is a snapshot of the different status in the Arab regions, not the Arab region, the Eastern Mediterranean region. So it's Arab and non-Arab states in our region. You will see that there is a great diversity and discrepancy in the access to safely managed drinking water and basic drinking water services, ranging from 100%, for example, in Kuwait, which is a high-income country, to 31% only of people, less than 1/3 of the population in Afghanistan have access to safely managed drinking water. Not only that, but also we are missing in 7 countries estimates on safely managed drinking water access to people in households. Next slide, please. And now we come to addressing the health risks of climate change on water resources. Climate change risks to health and the health systems, they result from a combination of climate hazards, diverse vulnerabilities and exposures. Furthermore, health systems and facilities have impacts on the environment and contribute to climate change. So the capacity and the resilience of the health system also plays a key role in determining our vulnerability to climate-related hazards as individuals and as communities. This combination of climate-related hazards and exposures and vulnerability lead to impacts on health, including injury and mortality as a result of extreme weather events, heat-related illnesses, respiratory illnesses, zoonosis, waterborne diseases, and water-related health impacts, which are highlighted here, and impacts on health systems and facilities. But of course, we have the potential to manage many of the health risks from climate change with the proper preparation. Next slide, please. Okay, so I think we went back. Next slide. Yes, so climate change is expected to increase in the incidence and the severity of extreme weather events, which are with droughts or floods or heat waves such as cyclones. And here now it's extreme rainfall resulting in flooding events, for example. This is one example of how climate change will increase the risk of waterborne diseases. Next slide, please. So this is just, a slide to show you with the myriad of effects, health effects and health impacts from water-related, waterborne diseases and water-related diseases as a result of water insecurity due to climate change. Climate change influences the transmission dynamics of numerous waterborne pathogens. Flooding events facilitate the spread of Vibrio cholera by contaminating drinking water sources. Similarly, pathogens like Leptospira thrive in stagnant floodwaters, increasing leptospirosis cases. Protozoa such as Cryptosporidium and Giardia, along with bacteria like Campylobacter and Salmonella, proliferate in compromised water systems, causing gastrointestinal illnesses. Norovirus outbreaks often surge in post-disaster settings due to poor hygiene and overcrowding in shelters. Drinking water is one of the main exposure routes for waterborne diseases, together with hands-mouth contact via food. Other routes may include water contact through, for example, bathing, farming, laundry, or floods. Certain chemicals also and some pathogens may pass from the contaminated water and the soil system into or onto crops and affect food safety. Thereby. Some disease pathways involve exposure to contaminated soil, such as hookworm and other soil-transmitted helminths. So poorly managed water and sanitation facilities, they can create breeding sites also for flies, mosquitoes, and other vectors of diseases such as trachoma and lymphatic filariasis and viral diseases. In some water bodies, extreme climate events could cause increased blooms of harmful algae, such as cyanobacteria and other water-based pathogens during periods of low flow and warm weather. So basically, unsafe water may cause diarrhea and other communicable diseases. Poor hygiene due to limited water may compromise infection control. Heat-related illnesses may be exacerbated by water shortages. And let's not forget about the psychological stress and the social tensions from competition and other conflicts also that may arise because of the water stress and water insecurity in the region. So, but microbiologically contaminated drinking water, let me give you this fact here, can transmit diseases, as we said, such as diarrhea, cholera, dysentery, typhoid, and polio, and is estimated to cause approximately 505,000 diarrheal deaths each year. This is according to WHO. Next slide, please. And the impacts of climate change is not the same for everyone. There are more vulnerable groups and marginalized groups, such as women, children, ethnic minorities, the poor, migrants, just like with many other problems, the elderly, and those with pre-existing health conditions. So reducing vulnerability and exposure and increasing the capacity of health systems and people and health workforce to effectively respond respond to climate-related threats and impacts is critical for managing the health risks of climate change. This can be done by strengthening the individual, community, and systems resilience, including increasing the capacity of the health system to manage and mitigate these risks. So in summary, climate change is more than an environmental issue. It's also a major health issue, and health professionals worldwide, like yourselves, are already responding to the health harms caused by this unfolding crisis. Next slide, please. And now we come to the interaction between water security, agriculture, and food production under climate change. In the EMR, food security is facing growing pressure due to the intertwined environmental and socioeconomic challenges. The largely arid climate in the region, limited water availability, and rapid population growth, as well as the strong reliance on imported food supplies, further intensify the fragility of the agricultural systems and deepen existing vulnerabilities. So increasing average temperatures and decreasing rainfall are already undermining the agricultural productivity in the region and across the region, elevating the likelihood of extensive food insecurity. Next slide, please. And this is a recent study that was published with the link on the bottom of this slide. It found that a 1% decrease in average a 1% increase in average temperature reduces food availability by approximately 8.2 kilocalories per person per day. So water scarcity, which is a long characteristic of the Mediterranean climate, is being intensified by climate change, as already been mentioned. Rising temperatures and the shifting precipitation patterns are increasing freshwater deficits and accelerating desertification across the basin. When you have reduced rainfall combined with over-extraction of water resources, this triggers cascading impacts and tensions across all water-dependent sectors, including agriculture, of course, which is the main point here, but also energy and tourism, industry, and domestic consumption. And projections indicate that climate change, water scarcity, and land degradation could reduce agricultural production by 17% by 2050, with marked regional variations. So declining crop yields due to drought and heat stress increase the dependence on irrigation, further intensifying competition over the limited water supplies. And in water-scarce settings, the unsustainable irrigation practices have contributed to soil salinization and widespread land degradation in some areas, thereby aggravating water and food insecurity. So although wastewater reuse is common in the Mediterranean region and has been practiced for so many years, its full potential as a safe and sustainable solution is constrained by weak governance structures and fragmented regulatory frameworks. We need to move away from the isolated sectoral strategies for water alone or food alone, energy, ecosystem, and toward a coordinated policies that acknowledge their interdependence and complex interactions. Next slide, please. And here is a table of the health effects that we can see from higher temperatures and changes in precipitation and how do they affect food production. So when we have these higher temperature and changes in precipitation, we have lower food production, lower access to food due to reduced supply and high prices, with combined effects of undernutrition and infectious diseases and chronic effects of stunting and wasting in children. You as health workers will be expected to see increased number of patients, particularly children, because these are vulnerable groups again, with diseases related to or made worse by undernutrition. Next slide, please. So in the water-scarce Mediterranean context, achieving Sustainable Development Goal 6 specifically, which is related to clean water and sanitation for all, is particularly urgent. as water stress undermines progress across multiple sustainable development goals, especially SDG 2, which is related to zero hunger, SDG 7 on affordable and clean energy, SDG 13 on climate action, SDG 14 on life below water, and SDG 15 life on land. So overall, climate change has weakened both food and water security through rising temperatures, altered rainfall patterns, loss of cryospheric resources, and more frequent and intense extreme events, thereby constraining progress toward the SDGs. Next slide, please. So strategies to enhance water security. There are so many strategies that are in place or are suggested to enhance water security, including conservation techniques, efficient irrigation methods, and community-based adaptation. And I know Dr. Maysoon Al-Zoubi from our brief interaction before this session that she is very much passionate about this. And she's such a guru because Jordan is a water scarce country and has experienced a lot of these strategies and is still trying and exploring other strategies. So next slide, please. There is a wide range of water adaptation option strategies. You can press as I go along, please. Next. Yes. So there are a wide range of water adaptation options or strategies and measures that have been or can be taken. And some are presented here, but they are not limited to, for example, planning for extreme floods through modeling and mapping flood extents and hazards, investing in water infrastructure, employing drip irrigation in agriculture, and the regulated treated wastewater reuse. We also shifts from water intensive to drought tolerant crops to reduce irrigation water demands, and rainwater harvesting for irrigation. Rainwater, this is it's particularly interesting because the rainwater capture is particularly useful in regions with uneven rainfall distribution to build resilience to shocks and ensure supplies for dry periods. So this is particularly effective in areas where water sources are unreliable or not available. Also, there are policies to reduce water demand, such as subsidies and extension support for modern irrigation systems. There's improved leakage detection in water distribution systems, and this is also very important to address non-revenue water, and offer incentives for reduced water consumption in private households through tailored tariff systems. Of course, we should not neglect desalination of seawater. In order to satisfy the increasing demand for potable water, the energy-intensive desalination of seawater has been employed already in many countries in the region, especially in the GCC countries, and is going to play a key role in the water supply system of many countries in the foreseeable future. However, please keep in mind that the seawater desalination represents a highly energy-intensive technology and may even provide copious amounts of, and contribute to greenhouse gas emissions. There are also nature-based solutions like the riparian buffers, which use ecosystems to naturally regulate water quality and improve quantity. Also, there are also community-based initiatives, which may include training sessions for volunteers and staff and community-based water committees to regular water testing, hygiene awareness, disease prevention, and health promotion, and also community-level trainings in schools and communities on education and hygiene measures. Next slide, please. And here I would like to present some of WHO risk-based management tools for water and sanitation. Now, the blue book and the blueprint book on water quality is the WHO Drinking Water Quality Guidelines, which are based on managing risks since 2004, and they are continuously being updated with amendments. An update is coming up soon as well. Guidelines for drinking water quality promote the framework of safe drinking water, where part of it is endorses the implementation of water safety plans by water suppliers to most effectively identify and manage risks from source, from the catchment to consumer. So, and so there you have the water safety plan manual. We also have sanitation safety planning on sanitation for the sanitation chain, same thing. So WSPs, the water safety plans, and sanitation safety plans are WHO endorsed frameworks that identify hazards, assess risks, and plan controls, integrating also climate change and integrating climate factors. This strengthens the resilience and helps prevent water contamination and ensures continuity under stress. Next slide, please. And finally, we come to the links between water security and wash infrastructure. Changes in the hydrological cycle will threaten the existing water infrastructure, making societies more vulnerable to extreme water-related events and resulting in increased insecurity. Extreme water events can increase water insecurity by affecting the functioning and operation of water infrastructure, including hazard protection, storage, and delivery capacity, and pollution and wastewater management. Next slide, please. Now we come to what's maybe more relevant to you as healthcare professionals with risks to healthcare facilities from climate change. Climate threats to health systems are particularly disruptive for individuals and communities when they affect healthcare facilities. The climate change can impact the delivery of healthcare services in large hospitals and small facilities in high and low income settings alike. So the infrastructure, the support systems and supply chains that healthcare facilities and their communities depend upon are challenged by climate change. Healthcare facilities are the first and the last line of defense to climate change impacts on health specifically. So strengthening their resilience along with their environmental sustainability is crucial to protect people from a range of climate hazards. Next slide, please. And why is this all important? Because the availability of sustainable wash or water sanitation and hygiene and waste management services supports the core universal health coverage aspects of quality, equity, and dignity for all people, especially in maternity and primary care settings, where they are often absent. Basic water sanitation and hygiene services in healthcare facilities are fundamental to providing quality care and for ensuring that primary health commitments are achieved. It can also improve health outcomes at the community level. The lack of adequate and safe drinking water and sanitation increases the spread of health-acquired infections and contribute to unnecessary diseases as well as antimicrobial resistance. Facility hygiene is key, for example, to preventing nosocomial infections and critical for the outbreak control, such as cholera. So failure to provide good water sanitation and hygiene services may lead healthcare facilities to become the loci of infections in outbreaks rather than helping. It makes things worse. Healthcare facilities would make things worse otherwise. So access to energy, water, and hygiene facilities also contribute to health worker retention. So it's not only about the patients, but also health workers. It is worth noting that wash services in healthcare facilities are substandard globally and also in the region. Next slide, please. So just in a nutshell, without safe water, patient safety and health outcomes are compromised. And next slide, please. And you can imagine how can we name a healthcare facility as providing care and services if it has no water, it's ridiculous. It's unacceptable, for example, for me personally. And I believe you agree with me on that. So this is also from the WHO UNICEF JMP WASH in healthcare facility service levels. This is from the 2024 report. An upcoming progress report will be coming mid of 2026. So stay tuned for that. It says here, the reports on the stats, the status of water sanitation, hygiene, healthcare waste management, and environmental cleaning in our healthcare facilities. Let's focus on water because this session is focused on water, addresses water. 74% of healthcare facilities in the region have access to basic water, where there is an improved water source that is on premises with water available at the time of the survey. But 27% of healthcare facilities still lack basic water services. Again, How can we provide services and quality healthcare to patients when we have no water available, no basic safe water available? Then this translates to more than 200 million people served by healthcare facilities with no access to basic water services. Next slide, please. And this is also from the Eastern Mediterranean region. You can see that there is 100% access, or healthcare facilities have 100% of basic water services in high income countries such as Qatar and Saudi Arabia, Oman, and Kuwait, while it's only 27% of healthcare facilities in Somalia have access to basic water. In Sudan, 27 in Sudan, 42 in Somalia, and 47 in Yemen. So there is huge disparities across the region. Next slide, please. And as mentioned again, the health impacts the same as in the community in healthcare facilities. There is more exposure to infectious diseases when we have no water and we have water insecurity in the healthcare facilities. There is increased risks of water and vector-borne diseases, and there is a more increased likelihood impacts from concentration of chemicals such as arsenic, iron, and fluoride, and increased risk of even liver damage and neurotoxicity, and risk of cancer and cardiovascular disease. And the consequences for healthcare facilities and how you're being impacted is with a declining water supply. This reduces the function of water-reliant sanitation, for example, systems and hygiene practices such as flush toilets and sewage and medical procedures. There could be unexpected outbreaks of food, water, and vector-borne diseases, and disrupted medical procedures and treatments, and increased likelihood of hospital admissions. Next slide, please. This figure illustrates the important dynamics affecting the climate resilience of healthcare facilities. So we need healthcare facilities to become climate resilient and environmentally sustainable. The level of resilience, which is on the right axis of this figure, will define whether the facility will recover when it is hit by a sudden event, such as a sudden flood or drought, to recover to its pre-event state, to recover but to a state worse than before, or to learn from previous experiences and put in place interventions to recover and attain a level of resilience greater than before the event, thereby achieving a transformation which would lead the health systems to be able to anticipate and promptly respond to increasing and more diverse threats that are posed by climate change. Next slide, please. And WHO has published technical guidelines on climate resilient and environmentally sustainable healthcare facilities to support an integrated approach to healthcare facilities and to promote intervention in the health sector, including around water sanitation and hygiene, waste management, energy, infrastructure, technologies and products, and the health workforce. This guidance document has been already used by many countries to develop regional and country level guidance and improvement plans. Next slide, please. And also I come to something that is very dear to my heart. It's the WASH facility improvement tool, water and sanitation for health facility improvement tool. It's called the WASH Fit, which is a practical guide for improving quality of care through water, sanitation, and hygiene in healthcare facilities. Next slide, please. The WASH Fit is based on 7 domains. You can press click across as I go along, please. Thank you. Which are crucial. These 7 domains are crucial for the healthcare facilities functionality and safety. And you see water is the first domain that pops up. These domains are water, sanitation, hand hygiene, healthcare waste management, environmental cleaning, energy and environment and management, and health workforce. So additionally, you can press please next. And you can see that two cross-cutting themes here is climate resilience and gender equality, disability, and social inclusion. So human health here with WASHFIT, human health cannot be protected and promoted only by the health sector. As you see, it depends on the efforts and active involvement of different sectors such as water, food, agriculture, energy, and urban planning. Next slide, please. This is my final slide. Okay, so for those of you who are interested in learning more, this slide, the resources slide at least, lists several resources, including guidance documents, tools, and research articles and reports that you may find useful. With that, I would like to thank you for your attention. Thank you very much. Over to you, Dr. Danieli.
Thank you so much, Dr. Rola. I think this was an amazing and a brilliant presentation on how WASH is fundamental for the health services to continue and how climate change can exacerbate the effects that we are already seeing in the region. And now we are going to talk a little bit about the solutions. We will have the Dr. Maysoon.
Hi, can I share my presentation?
Let me introduce you first. You can share your presentation. You can start to share your presentation.
All right.
So Dr. Maysoon Al-Zoubi is the project manager for the Building Resilience to Cope with Climate Change in Jordan through improving water use efficiency in the agriculture sector. The project is managed by the Food and Agriculture Organization of the United Nations. She was until recently the Secretary General of the Higher Population Council. Dr. Maysoon previously served as the Secretary General of the Jordan Ministry of Water and Irrigation. Maysoon joined the Royal Hashemite Court as a Senior Policy Analyst, Economic Affairs Department from 2007 to 2009. Prior to that, she was second to the Prime Ministry of Jordan as Senior Infrastructure Specialist from April 25 to April 27. She's an engineer, served as a technical committee chair for the ambitious Red to Dead Sea project, a negotiator and ambassador for the climate change in Jordan. She's a member in the managing committee of the Blue Peace Middle East Region Mechanism, initiator and co-founder of the Women and Water Diplomacy in the MENA Region Initiative, and a member in the U.S. National Academy of Science Committee on Transboundary Water Security. So enjoy this amazing presentation. Thank you, Dr. Maysoon, to be here.
Thank you. Thank you. Am I muted or?
No, we can hear you. Yeah.
Thank you very much. Good morning, good evening, good afternoon. Hi, everyone. I don't know, where are you? Thank you very much for giving me this opportunity to share with you our management of water, very challenged water situation in Jordan. So first of all, I will start talking about the problems, present and future problem. The single biggest Jordan water problem is scarcity. When we said scarcity, the existing water supplies are insufficient to meet the urban, industrial, agricultural, and environmental demand. And here I want to tell why scarcity matters. Water scarcity is a critical, multifaceted crisis with direct link to a severe impact on public health, environmental stability, and socio-economic system. But here I will focus on, although Rola, she talks a lot about health, but I will tell a little about direct public health consequences. So diseases outbreak when the water is not enough for even basic hygiene. This leads to spread of diarrheal diseases, cholera, typhoid, this. And again, contaminated water consumption when the water is not available. So people may use unsafe or go to resources which produce unsafe water, often rely on unsafe water sources. So this leading to high concentration of pathogen, toxin materials, and chemicals. Again, water is important for agriculture and food. So if we don't have water, definitely there will be like a malnutrition because water will not be enough. Definitely would decrease the crop yield and food availability, causing acute and chronic hunger, especially among kids. And again, if the water is stagnated and dwindling water sources provide a breeding ground for mosquitoes, which might cause a lot of diseases. So this is not, again, the problem as with water scarcity. We have a very rapidly growing population. So when the Jordanian population increases, the number of the Jordan population increases, so market forces will cause a significant reallocation of water resources from agriculture and environmental sectors to urban. This will result in intensifying stress on water-based ecosystem and, of course, the food production capacity. Again, because the water is very little and we have to serve people with drinking water, though, so the groundwater overdraft, we have a problem of this. So the absence of effective management of water resources, the water tables are drawn to a level where it is no longer economical to pump from them. Climate change induced hazards such as droughts, extreme temperature, and flash flood have tripled in Jordan since 1980s, comparing to doubling worldwide. This exposed population to a loss of life, livelihood, and property. Another thing is also future water supplies are also threatened by decline in water quality. Not all of the people are connected to wastewater and they use septic tanks, so maybe it's not fed well or lined well, so most of the water will drain. And of course, because of the agricultural operation, the type of soil, this will enhance drainage from agricultural operation. This can lead toxic material from subsurface to groundwater and to surface water. And here the map would tell Jordan, with the water that we have is barely enough for 4 million people. Now Jordan is 12 million. We receive a lot of, voluntary forced migration and expats received by Jordan, starting from forced migration from occupied Palestine, 1948, and then West Bank, 1967, then migration from Iraq through the two Gulf War, migration from also the Syria, after the since 1912, with this internal crisis that they have. Also with the Gulf, also we receive a lot of foreigners. They come as a worker, especially the Egyptian and others. And we have also the problem of returnees, Jordanian, who come back from Kuwait and from Gulf after the Gulf crisis. This is a climate change, like she said, the expectation or the climate variable annual mean temperature models illustrate there will be increase in temperature from 1 to 2 to 3 degrees centigrade. And also with the precipitation, the annual mean precipitation, 15 out of 20 models indicate decreasing a trend of 20 to 25. What is the impact on water? Most of the water in Jordan, it is either groundwater or surface water. We have no longer no rivers, all of them dry. So our resources depend on precipitation and with this means that even the recharge to our aquifer and the water that we have, it will be also decreased. Also, with high temperature, it's not only the availability of water will be decreased or the recharge of water to our aquifers will be decreased. It's also the demand will be higher because the evaporation increased and also the people, they will need water. So I'll talk a little bit about our water sector policy is based on the following. First one is, and then I will explain more, integrating the management of water resources, improving the quality of water and wastewater services, optimizing the use of energy sources in the water sector, engaging the private sector implementation of strategic project and management of water sector, and supplying water for agriculture, industry, and mining. With integrating, we talk about supply-demand sides. We work on both. With the supply, we focus on, like I said, the traditional or conventional water resources are almost depleted. We no more have rivers, and which is surface water. And when we talk about groundwater, it's overpumped. Like 10 out of the 12 aquifers, it's almost depleted. So any new sources of water, it will be from non-conventional, not traditional water resources. Like desalination, we started with desalination of brackish water, and now you know more about the national carrier, where we now practicing trying to get some desalinated water from seawater. We reuse our wastewater, reclaimed water, like 90% of the wastewater are reused. It is used now in agriculture to free some of fresh water. And again, we have now some example of deep aquifers. We were trying also cloud seeding. We had some experience with even condensation of the vapor, but because it's energy intensive till now, we cannot afford to do it. But we're looking for a new technology that might have this source in some places cheaper or use less energy. Again, like I said, with the precipitation, the prediction is to have more drought season, less precipitation, and there is also a change in the season. So the water, when we need, especially in agriculture, when they need water for agriculture, they don't have it in a time where it is needed. So the solution also, the problem of flash flood as well. So the solution of this is to expand more in water harvesting, especially in dams. So the plan is to increase the storage, so we can store this water where we receive it in a time that we don't need it, and then use it when we need it. So, and again, having this water will increase the recharge of our artificial recharge of our aquifers. And again, it is one of the mitigation for flash flood, which is we try to use it as a mercy, not how it damaged Jordan with the last floods that we received. So this is the thing. And again, increasing the storage, reducing the exploitation. The most precious water resource in Jordan that we have all realized is groundwater. It's clean, cheap, no evaporation. This is where we have to help with all policy, what we have to keep this resource. Because now we don't have water, but again, when we have the national carrier, the policy is definitely to stop some of these aquifers until we reach the safe limits or the safe yield of these aquifers, because they are the future. This is the water that is needed for our coming generation. So we have to protect it. We have tried to protect it, not to deplete this, or again also need. It's not in Jordan water sector, it is not the role. It is the role of the government, but I think everyone in Jordan has a role to play, because we're talking about water security and highly needed. It's a humanitarian needed. So we have to do a lot of a new partnership with local community, because they are our ambassadors in their community. They have to understand well the real situation and then talk and convince people to conserve water and to be careful. We have a lot of awareness campaign to teach people how to conserve their water, because this is what we have, and we have to help our country to protect these resources that we have. Again, also we have a problem of illegal use, and we have continue start campaign for tightening control, stopping. We stop illegal use of water and unlicensed wells. And definitely you have to have a right information system, accurate. And so developing a national water information system, because you need to know what you have, and all decisions should be like a decision making, evidence-based decision making. Without having the right data, you cannot even plan your water sector and then control and then measure the progress. The second one is improving water equality in Jordan, because we have the water and we have to use it very efficiently. So the plan is to have, and this is the national carrier, to have a national water pipe. This type, when you have a pipeline from south to north, this will help you provide flexibility in water supply and redistribution. We give water with this one, we can give it to the governorate that suffer from shortage of water, while if we have a lot of water in government, more than the things that surplus in one governorate, we can transport it to other. We have a big problem, which is then I like the word when Rola said non-revenues, because we used to use it. It is a waste. It is not waste. It is used. The leakage will go directly to the aquifers, but this is the water that we supply and not get paid back of it. And that's why the financial situation is important to be good and credible, and we lose this the cost that we didn't pay, no revenue from this water. For the word is non-revenue water is correct one, thank you. So the plan in our strategy is to reach 25% by 2040 through restructuring and rehabilitation of the network, and again also to eliminate violation of water network. It is not only leakage our problem. We have also a violation of and illegal use. Like I said, from demand management side, we have to continue carrying on water conservation campaign, helping people by installing water saving devices, helping them to build rainwater harvesting. We're talking about very expensive water. Like I said, it's very expensive. So the government cannot, it's unlimited. We don't have the choice of unlimited subsidy to the water. So in country, we have to help the Jordanian citizens. We have to help them to reduce their bills by demand management techniques. Wastewater, it's in our water budget, and reclaimed water, it's an item or important item in our budget. So we have to expand our network. And when we're talking about the national carrier, you talk about 300 desalinated water it is for potable use, by the way. This means 70% of it will back to the system as a wastewater. So it is actually not only 300, there are almost 500 something, because we reuse this water and it is desalinated water. I think the quality of water after treatment will be better. Definitely, like I said, we have to care about the financial capability of the institution that is responsible for managing of water. So we have to improve our financial efficiency through we have a special water loss reduction program. The plan is to reach 100 to cover at least maintenance and operating costs. And if you look at it, you don't think it is little, because most of our new project, it is a BOT project or PPP project. So the cost of those big strategic, it will be part of operation and maintenance. So it will be under this. It will be definitely a great challenge to reach this. Like I said, the water sector is the highest consumer nationwide. We use like 18% of the energy, and it's very expensive. So the plan is to optimize the use of energy in water sector by first improve energy efficiency in pumping in all the water facilities. The target is to reduce the energy used per cubic meter of water, produce, desalinize, and also treat it. Again, we also have a plan to introducing renewable energy technology. The plan is to reach 40% of our electricity by 2040 to reach this. And also we have the wastewater treatment plant, increase like in Samra, most of its electricity produced produce from methane. So we want to replicate this to improve the treatment plants so they can generate methane and use their electricity from it. Private sector, we are the first in the region that we start this public-private partnership with the private sector. We have a big project with most of our strategic project. It is run based on PPP scheme where we have the private sector. There we partner with them and they manage those new facilities for a certain period of time and then return it back to us. Definitely, it won't be for us as a government. It will be for another national company to run it because each sector has its own characteristic and it's better to give the role to those who are good in it. Also, we have a private sector and water facilities that need private sector thinking where they can provide a new innovative cost effective solution and also they participate in financing and maintenance and renovation because now donors are not like ages of before. The money is very little. So we have to start think how we can depend on our self and our resources. And we have also a good model of contract, which is reducing water loss reduction and through a performance-based contract. So they can have their money if the amount of water or the amount of bill that they can collect. Again, the agriculture is very second priority in Jordan. So the idea to produce water for agriculture, but the idea it's reclaimed water, but it's not extra amount of water. They replace the fresh water where we send it to potable use, and they use a treated wastewater for agriculture. Again, we have a lot of program of promoting efficient use also of water in agriculture because we care also about food security, and for other, which is mining and industry, we use deep aquifer and brackish water because those they can afford like having this source of water. It's more or less expensive. Now I'll talk about the project that I am the project manager. Definitely with this, it's accompanied by like strengthening the water institution. Yani whatever you put, what policy you have, what tools, if you don't have the right people, the workforce that they manage this, it is nonsense. If you don't have the right public institution to manage this, to implement those policy. So we have also a big program with strengthening water institution through structure. Now, like I said, that we have like 3 regional water company. It's public company, but run on commercial basis. We have the POT with us, different type of strategic done by the private sector, and also a transparency. We encourage all stakeholders to participate with the government in managing of water resources through a water user association in the Jordan Valley. And also we have like a Highland Water Forum. We established this where we have everybody on board and they help us understand and they help us with their ideas. The name of my project, it is the first project that won by the Green Climate Fund. He got fund from the Green Climate Fund and the accredited agency is FAO. It's basically about the efficient use of water in agriculture. The main objective of this project is to increase the climate resilience, sustainable development in the country. This project is adaptation. I encourage anyone who will apply to use both mitigation and adaptation because with mitigation you can have renewable energy, you can have energy efficiency, at least forestry also. It is part of mitigation. And the accredited, like I said, is FAO. The total budget for this, which we get $33.25 million grant from the GCF or the Green Climate Fund 25 with co-financing from UNDP, FAO, and the government of Jordan, 8.25. The duration of this project is 7 years. In this project, 3 interrelated components have been integrated into the project design to address key barriers and enhance the impact of a project investment. The component 1 is a climate resilience water system. And this is especially for enhanced water security. With this component, we will, the goal of this component is to reduce the vulnerability of farming communities that are currently struggling to cope with the climate change-induced water stress by providing the farmers with additional water to increase agricultural productivity. But this water, it is not from the resources that overall, without increase any overall drought from the available resources. So it will be like reclaimed water. So this one, an investment will made to promote the uptake of a proven water conservation. And we looked, before we write the funding proposal, we looked what success story that we have, and we adopt the success story from them. It's conservation solutions such as harvesting, rooftop, and Rola, she talked about this one, and also using the water saving devices as well, and using the reclaimed water. Here, the reclaimed water with our project, we are not constructing treatment plants. Some of the treatment plants, they produce very good treated water or reclaimed water, but during winter time, the demand is low. So they release it into wadis. Our intervention in this project is to build the infrastructure, increase their storage capacity in those plants. So where they can store this water, this will help improve the quality of water, although it's very well regulated, and then they can use it when they need it. So this is our intervention. The first one is like rooftop water harvesting. We use both for public and household. Public, half of them are schools, so because we need to teach the students about this, the importance of this water. And for the household, it's around 8,000 based, and I choose the governorate that suffer. They are very vulnerable, where people, they depend on agriculture for their living, and they suffer from shortage of water, which is the southern governorate of Jordan. And with the wastewater, like I said, this is the storage. We increase storage capacity, so of 3 treatment plants. You see here, this is what we say the roof tank water harvesting system. The catchment area is the roof, because I always want to clear this to people. When they thought tank, they thought the tank will be on the roof. So the catchment area is the roof of the house or the public buildings, and there will be underground tank where they can we send the water during winter, and they can use it even during one. When we say the capacity of the reservoir is 20 cubic meter, does not mean they can have only 20. They can use it during winter time, so they reduce their bill, and they can also store some in summertime. We need people to get the buy-in of people. So there is a contribution from the beneficiaries. They have to install water-saving devices, because we need them to understand. Anything you give it free of charge, people, they don't respect unless if there is some little things of them they can participate. And this is the plant. You see, this is the peership well, and you see those people. This man, he is in Tafile, and we visited him. He said he lived in an area which is very high, even the domestic water. He cannot receive municipal water because there is no difference in the level of his area. And he was very thankful to us. We provide this water to him because he has to buy water, and it's very expensive. This is one of the cases that we want to show. The second component is climate change resilience for enhanced livelihoods and food security. So this one, we produce the water. And again, this will help. We focus on the household and the small farmers to build the household resilience to climate change, strength, one of them, then also strengthening an e-extension system to reach to reach the farming household and provide tailored gender-based messages about, it's like an extension, but it will be like an application or where people, they receive messages, they receive the right solution for their case remotely. And then I always, gender, it is a big thing in my life, always focus on in gender. So we have a program where we have like climate-wise women. We choose, the target is 400 women. We started with 8 women from two from each governorate, and we have a special, very condensed course, 6 months, done by Mu'ta University, where we train those people, those women. They are from agriculture department, they study university, and we equip them with the right skills and knowledge to be smart on smart agriculture and efficient and water resources, efficiency in water resources. And those we will provide them with a temporary job opportunity. Like we will hire a service provider. He will use them because they need to train 400 women, and then the 400 women, they have to train the 10,000. Then they will have up to, we introduce them to private sector, to farmers, and then they can proceed from there. But we do this, how we do this? Through farmer feed school. This is a good thing in FAO, which I like. They go, you will see, they go to the farmers and they work with them. We produce the knowledge material that is tailored and needs Jordan, Then they sit with farmers and see what suits them best, and they use the material that is available in their houses, because it needs to be affordable. And then we do this. The target is, this number, where all of our activity is gender responsive, and it has to be gender responsive. With gender here, we meant the woman. So that we have a special gender expert, who makes sure all activity is gender responsive. It's also with the extension. So we have the new knowledge material about climate change, smart agriculture. So climate smart agriculture. So it will be available also to all, not in the project area, but it will be to whole Jordan by extension. And this is the climate-wise woman. This is what I told you about. With this project, we managed to produce 11 knowledge management products regarding climate smart agriculture technology. You can have it. Whatever I produce in this project, I make sure it will be published. So it will be available for everybody who want to learn. So we publish them, and you will find them in FAO website. And we also produce like a 6 model developed. A 6 model have been developed. All talk about smart agriculture. All talk about efficient use of water, because we are very specific in this project. And also we have another module, 6 modules. It talks about the idea of field farm school and teach people. All of them, if you are interested, you can go to the website and see. And this picture, you see people, we do this, and for sustainability. So this, what we are doing, is not finished after the project is completed. In Ministry of Agriculture in Jordan, they are responsible for farmer feed school. We check first, they don't have any material about any school about smart agriculture, climate smart agriculture, but we deal with them because then they can use it in the future. So what we are doing now, it will be sent to them and they will use it. So we start first with a workshop where we have extension staff in Ministry of Agriculture. We taught them, we explained to them all the catalog, all the technology, the practices that we are using. And then now we have a letter of agreement, we sign letter of agreement with Ministry of Agriculture. They are now like a service providers to us. They do all the farmer feed school. But this is then this is the exit strategy. Whatever we do, we work with the government, because one of the target is to build the capacity of government to be more climate smart. So whatever we do, it is there and they can use it. If you look at this, and if you like, anyone come here would like to visit, those are our extension people, and they do it with farmers, and you will be amazed how people are thirsty for this type of technology, because they start suffer from shortage of water, and most of them their living is this farms. The acceptance rate is higher, and to measure the people, the adoption, we have a special application. It measures, when we do farmer feed school, we use one of the farm, but we invite others. We have the total is 4,000. So we have application, and this application will be given to the extension people in Ministry of Agriculture, where we measure the rate of adoption. And whatever you put, you have to measure the impact. Otherwise, you want to make sure what you think is good or not. This is even with our project. You see the different types: subsurface irrigation, cocoon, Zola. This is one of the fodder. They use it and they cover the pond. Amazing things. And in those, they used to tell us in Ma'an, they are very conservative and they don't want to learn, especially gender. Most of the extension are women in Ma'an. And you see, they are doing the exercise hand in hand with men to improve the agriculture and to improve food security in Jordan. This is special. This is very, this cocoon, it costs like 7 JD or 3 JD, I don't know. But they plant different with cocoon and without, and you will be amazed with the rate of production, the most of water they use. They understand this, and they measure it with. You need to use material that is affordable and accessible to people in this rural area. Never come with a high technology and ask people to do it. And you have to invest more in applied research and something that is affordable to people. The last one is scaling up climate adaptation into policy and across sectors. This is the third component. And in this component, what we are studying the policy, regulation, the gap, and we choose one because we cannot do everything under this project. We are working with Ministry of Water to improve the specification for reclaimed water, the use of reclaimed water. And we will have this report when it's approved. You will see it published. We study the policy and see how we can what is the gap so others they can do. And then it's not only so with this component we support mainstreaming of gender sensitive adaptive tool and practices for improved resource management in the national policy and in the educational framework, as well as administrative, economic and social framework at target area. Well, activity we are doing under this component include promoting the adoption of drought, tolerant grains, climate smart agriculture, and water management, water efficient technology. And it's not only we do this, it is we do a workshop. Whatever you bring to Jordan or any place, if people don't know about it, it will not be good, or it will not be adopted. So we have a special workshop. Whatever we produce, any practices with different sectors. These you see, and it's always you see the women. A lot of them are there. 1 minute, I'm finished. So local engagement first with the climate change adaptation. We have training course for civil society, start with civil society, and again with municipality. They have to understand because they issue license and they do everything. And we talk also about national green construction and water saving devices. Also, it's part of the workshop. And this thing, I don't know if I have to stop what Daniela finished. Thank you very much. But I want to say this. We focus on women because they are the most vulnerable in these governorates, because they don't have access to the financing, to the resources. They are not too much part of the decision making. For those people we want, and they live on this type of a product. That's why we have all of our activity as gender responsive. Sorry for talking too much, and thank you very much. Ready for any answer.
No, I think we can listen you for many time, and I was loving all the and also all the people in the chat. You can see how many good comments that you had. So let's start our discussion. We have many questions here. I think this session was amazing, and we clarify not only the impacts, but we also brought a lot of solutions and how this can be done in using not high technology, but technology that are affordable for people, and that's the way that things can work better. So I have many questions here. Let's see how many that we can address. People want to know how can rainwater can be safely used after the harvest. I think maybe you can mention a little bit on this regarding on the different use that people can have, and how is the process to make this water safe to drink, to use in the agriculture.
You want me to answer this?
Yeah.
We have a special instructions. Guidelines. This water, it can be used for everything except drinking purposes. And when we have this program, we are providing those tanks to people to encourage them to use it. But again, it will be accompanied with awareness campaign. We go to people and we explain to them what is the important, why they should have it, and again, where they can use it. If they want to use it for domestic, for potable, they have to buy a small treatment plants. But it's clear to them. But again, like I said, they can use it for washing. The idea here, we want to, this garden, food garden or something like that. I'm not from agriculture, I'm water expert, but I'm learning from them. So we want to help those people to use this water to produce their food. It can be used for everything, and it's clear to people. And we have a program, a special program, a workshop where we invite people, go to them, explain to them. Although it is not, like I said, we built on something that is used, and we change our building code, that each house, they have to have this water harvesting. We need, like I said, the new water is very expensive. New water, it is desalinated water, not like treated water, but they use it in. So we need now people, they have to understand the coming resources, very expensive. So you have to work hard on water demand management. Those who will benefit from reservoir, they have to install water saving devices. And again, with time, they will understand this. Now, the tariff, the government, they took a decision to increase tariff 6% annually for the 5 years. And maybe when we have the national card, they will increase more. And the government, they cannot support. So the only thing, those people, is to reduce the bill. How you reduce the bill? You provide this like a free source of water. So yeah, it is very well, even with the reclaimed water as well. We have a special, we will make under this project a special leaflet for water harvesting. And even I will tell them from where we have another public institution where they can borrow money from them to have this, because definitely in the future people, they will look and run after this. Don't worry, it is clear, and definitely we will not come with something that people they don't know. Everything we are doing is accompanied by awareness to people and talk with them about. One thing also, the curriculum I forget to tell, we put this material in the school and in vocational college and in the university. Those smart agriculture and efficient use of water, we will work with university where we add to their curriculum. So people from this elementary school up to the vocational colleges and in the university, the climate change adaptation and mitigation, it will be, we produce this and it will be part of their curriculum.
Amazing. Yeah, that's super important to close the cycle and make sure that everybody is informed and have the knowledge. So I will have another question to Dr. Rola, continues a little bit this topic and more related to waterborne diseases. Considering that groundwater contamination is increasing and climate change is threatening future water availability, what sustainable strategy should public health system adopt to ensure safe drinking water and prevent waterborne diseases in vulnerable communities?
Yes, sure. Now, as I had mentioned and referred to in my presentation, WHO Drinking Water Quality Guidelines endorses the framework of safe drinking water, where first, by the regulatory authorities in the country, they should set health-based targets. Okay, that public health targets that they should be all water suppliers and water utilities have to abide by. And then comes the role of the water utilities, where they have to implement what we call water safety plans, which is a risk-based management approach to addressing all the hazards and the risks that are relevant to water, from catchment all the way through the treatment, distribution chain, everything until they reach the consumers. And then there is the role of surveillance, and this is the role of the public health authorities, the ministries of health or public health authorities, where they have to undertake surveillance. And with this framework of these three steps, we ensure safe drinking water all the way across the board. Over to you.
Thank you. There is also a question regarding the participation of women in the program, Maysoon. What was the significant contribution of the Climate-Wise Women program? And so far, what is the success rate of the program, and what is the eligibility criteria for recruiting these women? I think it's very important, this topic, and because in some places, women are the responsible to catch the water and bring to home. So
we are still in the beginning, but again, when I decided this, it was built on initiative. I did it and I love it. When I was Secretary General of Ministry of Water, it was Water-Wise Women, where we train women to be plumbers. For us, water, it is very heavily subsidized. So I don't want people to use more, even they pay for it. They don't pay the total cost. For in some conservative area, they don't allow the plumbers to come in the morning. So we waste the water until the man come back. So we train them. Based on that, it was a very restrict criteria. We visited the three universities in the south. We chose Mota because they have a special institute there. And we have a very restrict, we announce, we have a jury from the government and we choose them, very strict, and then we train them for 6 months. Those, even now, for the 400, now we are in a process of choosing the 400 from the 4 governorate. It is very strict, very well-designed criteria. It's not open for everyone, because we're looking for a very equipped, skilled generation who can, that we give them opportunity to work or job opportunity, but again, they will help us save our water. It's very strict. It's not open just for everyone. Not only us. We have representative from Ministry of Agriculture, Ministry of Environment, and us from the administrative of this project. With the future, I will tell, because now we are in a process of choosing the 400, and we will do this training to them by the 8 women that we train in the beginning. But we
Can I
will
say
see
something?
this.
Sure.
Can I say something? I just would like to draw your attention, since we're talking about water and gender, that the United Nations World Water Day, which is observed on the 22nd of March of each year, and this year the theme is water and gender. So this also ties very nicely to this discussion. So I would like you also to visit that the webpage on World Water Day of
And with
2026.
FAO, they ask me, I send them insight from those women. I send them a success story. I talked about women,
Nice.
and if you like, you can see them there.
Great. Thank you.
Yes.
So thank you so much. I think we definitely had an amazing session and with so many information and ideas, and so I think we have a lot of good materials here that people can be inspired and people can work with and do some changes in their region. And thank you so much for both of you sharing your amazing experience with us.
Of course.
Welcome.
Thank you very much for having us. Thank you
And
very much, everyone.
Thank you for all the
Goodbye.
participants. We had like 500 people here today, so it's a
Great.
good number. Bye bye. Thank you.
Bye-bye.
Bye-bye.
Bye.